Can you remember the last time you got out of bed and just stood up without thinking? No pause, no reaching for the nightstand, no waiting for your knees to loosen up first. For many people over 60, that moment is gone. And for many, that first step of the day is where the decline quietly begins, putting more pressure on your knees than you realize. Now your morning starts differently. You sit on the edge of the bed. You lower your feet slowly. And before you even take that first step, you hesitate because your knees feel stiff. Your hips feel tight. And sometimes there's that quiet, creaking feeling like something just isn't moving the way it used to. That short walk to the bathroom, it doesn't feel automatic anymore. It feels like a negotiation, a quiet moment where your body decides how much it's willing to give you today. If you're dealing with knee pain, especially when you stand up or walk upstairs along with stiffness or aching joints in the morning, then this is something you need to understand right now. Because that stiffness, that hesitation, that warming up your legs every morning is not just aging. It's a signal. Your body is slowly losing the connection that keeps your legs strong, stable, and responsive. And when that connection weakens, your knees take more pressure, your hips tighten, and simple movements start to feel uncertain. That's why getting out of a chair, walking across the room, or climbing a few steps can feel harder than it should. But here's the surprising part. Researchers at the University of Tokyo found that simple daily movements can help reactivate leg muscles and reduce pressure on your knees even after 60. Research shows that a simple chair-based movement done correctly and consistently can help restore that connection, improve circulation, and reduce pressure on your knees in as little as 14 days. Not by forcing your joints, but by helping your body move the way it was designed to. Again, in today's video, I'm going to show you exactly how this works and walk you through simple movements that can help you feel steadier, move easier, and rebuild strength, even well into your 80s or 90s. This simple chair exercise is designed to help you rebuild stronger legs and take pressure off your knees starting today. And the best part is these movements are simple, can be done sitting down, and take less than 10 minutes a day. No complicated routines, no equipment, no need to push through pain. So don't skip what comes next, because the final movement is the one most people overlook, and it can take pressure off your knees the moment you stand up or climb stairs. But before we begin, let me ask you a quick question. Where are you watching from today? I read and reply to as many comments as I can, and your experience might help someone else watching right now. Let's take 30 seconds to see how much stress your knees are really under right now. No equipment, no standing, just simple, honest answers. You'll start with 5 points. For each one that feels true for you, subtract 1. Ready? Number 1. Do your knees feel stiff or heavy when you first get out of bed? If yes, -1. That stiffness is often the first sign your leg muscles aren't activating properly in the morning. Number 2. Do you feel unsteady for a few seconds when you stand up? If yes, -1. That hesitation usually means your balance and muscle response are starting to slow down. Number 3. Do stairs feel harder than they used to even on a normal day? If yes, -1. That added difficulty often means your knees are taking more pressure than your muscles can support. Number 4. Do your knees feel sore or tight after sitting for a while, like when you get up from a chair? If yes, -1. That stiffness after sitting often means your joints aren't getting enough support from surrounding muscles. Number 5. Do you sometimes avoid movements like bending down or taking the stairs? Because you expect pain? If yes, -1. That avoidance is a sign your body is starting to lose confidence in your knees and how they move. Now check your score. If you're at 3 or below, your legs are already showing clear signs of weakening. And the good news is what you're about to learn today can help reverse that pattern if you start early. Now, without any further delay, let's begin with the first movement. Because when you activate your legs the right way, you don't just reduce discomfort, you start to feel in control of your movement again. Exercise number 1, exercises 1 chair hold, and rise strength builder. This first chair exercise may look simple, but it can make a big difference in how your knees feel when you stand up. And for many people over 60, this is exactly where your knees start taking more pressure than they should. Because sitting too long doesn't just make your legs feel tired, it slowly makes them feel heavier, slower, harder to respond. And when your legs don't activate properly, your knees are forced to carry more load than they were designed for. Most people don't notice this until the pain starts showing up. And over time, That's exactly what leads to more pain when you stand or climb stairs. You may notice it when you try to stand up. That slight delay, that moment where your legs don't feel ready, that's not just aging. It's because your muscles aren't being fully activated anymore. And over time, the connection between your brain and your legs starts to weaken. When that happens, your knees begin to take more pressure. Your hips stop supporting properly, and standing up becomes harder than it should be. This is where the chair hold and rise strength builder becomes powerful. But here's the mistake most people make. They move too fast. They barely engage their legs, and they skip the hold completely. That's exactly why they don't feel any real improvement. So, here's how to do it the right way. Sit on a sturdy chair. Keep your feet flat on the floor about hip width apart. Now, slowly press your heels into the ground and begin to lift your body slightly off the chair. Not all the way up, just enough so your weight is supported by your legs, not the chair. Hold that position for 3 to 5 seconds. Then slowly lower yourself back down. Pause for a moment and repeat. Start with 5 to 8 repetitions. Move slowly. Stay in control. A few important notes. Don't hold your breath. Keep your chest upright. Don't lean forward too much. And press through your heels, not your toes. You should feel your thighs doing most of the work, not your knees. That small detail alone can make a big difference in how much pressure your knees feel. Now, here's why this works so well. This movement activates your thighs and hips, which are supposed to support your body when you stand. When those muscles engage properly, they take pressure off your knees. It also helps rebuild the connections between your brain and your legs, so your movements feel more stable and controlled. And over time, your body starts to respond faster, especially in those first few steps in the morning. If you do this consistently, many people start to notice changes within 7 to 14 days, especially when standing up. Standing feels easier, your legs feel more responsive, and that hesitation begins to fade because you're not just strengthening your legs, you're retraining them to support your knees the right way. So, if you're doing this with me, type press in the comments. I read them all, and it helps me know you're taking action today. This is where most people think they've done enough, but this is exactly where they fall short. Now, this movement works while you're sitting, but real weakness shows up when you try to stand and move. And if you stop here, your knees will still take too much pressure when you stand up or climb stairs. That's why the next exercise is even more important. Exercise number 2, chair sit-o stand reset. This next chair movement may feel familiar, but done the right way, it can completely change how your knees handle standing. And before that first step even happens, it starts right here when you stand up. For many people over 60, this is where the real problem shows up, especially in the morning when your body hasn't fully warmed up yet. Not when you're sitting, not even when you're walking, but in that exact moment when you rise from a chair. And this is where your knees are under the most pressure. And for many people, this is the exact moment where knee pain begins. Because when your legs aren't working together properly, your knees end up doing the job alone. That's when you feel it. That push, that strain, that uncomfortable pressure right in the front of your knees. And if this keeps happening, it doesn't just stay the same. It gets worse. Because every time you stand up the wrong way, you reinforce the pattern that puts more stress on your joints. Most people don't realize this, but the way you stand up is either helping your knees or hurting them. This is where the chair sit-o stand reset becomes essential. It's not just about standing. It's about retraining your body to move in a way that protects your knees. But here's the mistake most people make. They lean too far forward. They push off too quickly, or they rely too much on their knees instead of their hips. And over time, that's exactly what keeps the pressure in the wrong place. So here's how to reset it properly. Sit on a sturdy chair. Place your feet flat, slightly behind your knees, not too far forward. Now, gently lean your upper body forward just a little, keeping your back straight. From there, press through your heels and slowly rise to a standing position. Don't rush it. Feel your hips and thighs doing the work. Once you're fully standing, pause for a second. Then slowly lower yourself back down with control. That part matters just as much as standing up. Repeat this for 6 to 10 repetitions. Move with intention, not speed. A few important notes. Don't let your knees collapse inward. Keep them aligned with your feet. Don't push off with your hands unless you absolutely need to. And keep your weight balanced, not all in your toes. If you feel it mostly in your knees, you're doing it wrong. Now, here's why this reset is so powerful. It teaches your hips and thighs to take over the work they were always meant to do. When those muscles engage properly, they absorb the load that would normally go straight into your knees. That alone can reduce pressure in one of the most stressful daily movements, standing up. It also helps your body relearn balance and coordination so you don't feel that same hesitation or instability. And over time, your movements start to feel smoother, stronger, and more controlled. Many people notice within 7 to 14 days, standing up feels more natural than that. Sharp pressure in the knees begins to ease because you're not just practicing a movement, you're correcting it. You're teaching your body how to move without overloading your knees. So, if you're doing this with me, type stand in the comments. It tells me you're not just watching, you're actually taking action. Now, this reset helps when you stand up from a chair. But there's another moment most people struggle with even more. And if you don't fix that, your knees will keep taking the same pressure every single day. Because the real test isn't just standing. It's what happens right after that first step. That's why the next exercise is even more important. Exercise number 3, morning chair wake-up lift. This morning chair movement may seem small, but it can change how your very first step feels when you get out of bed. For many people over 60, this is the exact moment where your knees and legs are at their weakest. Not later in the day, not after long activity, but right at the beginning when your feet first touch the floor. And this is when your legs are at their least prepared, because after hours of rest, your muscles aren't fully awake yet. They're slower to respond. They don't engage as quickly. And when that happens, your knees and joints take on more stress than they should. That's why those first few steps can feel stiff, heavy, or slightly unstable. It's easy to overlook this. You simply move through it and continue your day. But those early steps quietly shape how your legs perform afterward. This is where the morning chair wake-up lift becomes important. But here's the mistake many people make. They stand up and walk immediately. They skip any form of activation, or they move too quickly without control. And that's when discomfort or imbalance begins to show. So, here's how to prepare your legs the right way. Sit on the edge of a chair. Keep your back upright and your feet flat on the floor. Now, slowly lift one foot a few inches off the ground. Hold it there for 2 to 3 seconds. Then, lower it back down with control. Switch to the other side. Move steadily and stay relaxed. Repeat this for 8 to 10 repetitions on each leg. A few important notes. Keep your movement controlled. Don't swing your leg. Avoid leaning back or shifting your weight too much. And keep breathing naturally. You should feel your thighs gently activating, not your knees straining. Now, here's why this works so well. This movement helps wake up the muscles in your legs before you place your full body weight on them. It restores the timing between your brain and your legs, so your movements become quicker and more stable. That means when you stand and take that first step, your body is already prepared. Instead of your knees absorbing all the pressure, your muscles begin to share the load. And over time, those first steps feel lighter, steadier, and more controlled. Many people notice within 7 to 14 days they no longer hesitate in the morning. They feel more confident and more stable from the very beginning of the day because you're not just moving your legs, you're preparing them to support you properly. So if you're doing this with me, type wake in the comments. It lets me know you're starting your day with intention. Now this prepares your legs before you stand. But once you begin moving, a different challenge appears. And if that part isn't addressed, that same pressure will return the moment you start walking. The next movement focuses on keeping your legs stable while you're already in motion. Exercise number 4, exercises 4 seated morning knee release. This seated morning movement may feel gentle, but it can change how your knees feel for the rest of your day. For many people over 60, this is when stiff knees begin to control how you move instead of you being in control, especially in those first few minutes after you wake up. Not from injury, not from overuse, but from that tight, restricted feeling in your knees before your body has had a chance to fully loosen up. After hours of staying still overnight, your joints don't move as freely. Circulation slows down, the tissues around your knees tighten, and your range of motion becomes limited. That's why bending your knee in the morning can feel uncomfortable, restricted, or slightly painful. And if you ignore that stiffness, it doesn't just fade away on its own. It follows you into the rest of your day. Walking can feel tight, standing can feel awkward, and your movements don't feel as smooth or natural. This is where the seated morning knee release becomes important. But here's the mistake many people make. They try to stretch too aggressively. They force the movement or they rush through it without control. And that often makes the stiffness worse instead of better. So here's how to release your knees safely. Sit comfortably in a chair. Keep your back upright and your feet flat on the floor. Now slowly extend one leg forward. Straighten it only as far as feels comfortable, not forced. Hold that position for 2 to 3 seconds. Then gently bend your knee and return your foot to the floor. Move smoothly and stay in control. Switch to the other leg. Repeat this for 8 to 10 repetitions on each side. A few important notes. Avoid locking your knee completely at the top. Keep the movement steady, no sudden jerking, and stay within a comfortable range. You should feel a gentle release, not sharp discomfort. What this movement does is restore motion in your knee joint after long periods of inactivity. It improves circulation around the joint, helping reduce that stiff, tight feeling, and it allows your knees to move more freely before you begin walking or putting weight on them. When your knees move better, your entire leg function improves. That means less restriction, less hesitation, and smoother movement throughout your day. Over time, many people notice within 7 to 14 days. Their knees feel less stiff in the morning and more comfortable as they start moving because you're not forcing flexibility. You're gradually restoring it. You're helping your joints return to a natural range of motion. So, if you're doing this with me, type relief in the comments. It shows you're taking care of your knees the right way. Now, this helps reduce stiffness while sitting. But once you move through your day, another issue can return. And if that isn't addressed, that same stiffness can return later in the day, even after you've been moving. The next movement brings everything together so your legs stay strong, steady, and supported. Exercises 5. Exercise number 5, chair hold and controlled stand flow. This final chair movement brings everything together and it can make the biggest difference in how your legs feel throughout the day. For many people over 60, this is where your legs either support you or start to let you down when you move. Because it's not just about standing, it's not just about your first step. It's about what happens next. This is exactly the moment when your body has to stay stable even after you're already moving. And this is where many people begin to notice the problem. Their legs feel weaker after a few steps. Their knees begin to take more pressure, and their movement becomes less steady the longer they stay on their feet. That's not random. It happens when your body isn't coordinating properly. Your muscles activate too late. Your joints take on too much load, and your movement loses its natural rhythm. When that happens, even something as simple as walking across a room can start to feel uncertain. This is where the chair hold and controlled stand flow becomes essential. But here's what many people get wrong. They treat each movement separately. They activate their legs, but don't control the stand. They stand, but don't control the transition into movement. And that disconnect is exactly what keeps the problem going. So, here's how to bring it all together. Sit on a sturdy chair. Keep your feet flat on the floor about hip width apart. Press through your heels and slowly rise to a standing position. Pause at the top for 2 to 3 seconds. Feel your legs supporting your body. Then take one slow, controlled step forward. Pause again. Then step back and slowly return to sitting. Move through each phase with control. Repeat this sequence for 5 to 6 repetitions. Take your time. This is not about speed. It's about coordination. A few important notes. Keep your posture upright. Don't rush forward. Make sure your knees stay aligned with your feet and move slowly enough to feel each part of the movement. If any part feels rushed, you lose the benefit. What this movement does is connect everything your body needs to move well. It links activation, standing, and stepping into one smooth, controlled pattern. So instead of your knees taking sudden pressure, your muscles guide the movement from start to finish. That reduces strain, improves stability, and helps your body move with more confidence. Over time, many people notice within 7 to 14 days, they don't just feel better when they stand. They feel more stable as they move. Walking feels smoother. Transitions feel easier. And that hesitation begins to disappear because you're not just strengthening your legs. You're retraining how your entire lower body works together. So, if you followed all of these with me, type strong in the comments. It tells me you're committed to rebuilding your strength step by step. And remember this, it's not about doing one movement perfectly. It's about building a system your body can rely on. When your legs move the right way, everything becomes easier. Standing, walking, and staying independent every single day. And if there's one movement you should come back to every day, this is the one that ties everything together. If there's one thing I want you to take away from today, it's this. Losing strength in your legs doesn't happen all at once. It happens quietly, little by little in the small moments we often overlook. The way you sit, the way you stand, the way you take those first steps in the morning. But the good news is those same small moments are also where you can begin to rebuild your strength. You don't need complicated routines. You don't need hours of exercise. Just a few simple movements done consistently can help your legs feel stronger, more stable, and more reliable again. Especially when you stand, walk, or take those first steps at the start of your day. Imagine standing up tomorrow morning and feeling just a little more steady than you do today. That's how progress begins. Not all at once, but one small improvement at a time. So, take your time with these movements. Come back to them each day and notice how your body begins to respond. If this video helped you, consider subscribing to the channel. I share simple movements like these every week, designed to help you stay strong, steady, and independent as you age. And if you want to go further, I recommend watching the video on this channel about building stronger legs, even into your 80s or 90s. You'll find it right here on the channel, and it connects perfectly with what you learned today. Also, if you're over 60 and feel like your legs are getting weaker week by week, you can explore the full series here, focused on improving leg strength step by step. Each video builds on the last, so you can follow along at your own pace. You're not trying to become perfect. You're simply working toward moving better, feeling steadier, and staying in control of your body. And the more you move the right way, the more your body will support you in return.